Welcome to Mom and Mine, a podcast about maternal mental health, from conception to pregnancy and postpartum. Real stories from moms and family members who have made it from struggling to wellness, and interviews with experts and advocates who work for moms and families to get the help they need. We discuss very real struggles that can sometimes be hard to hear, but these are stories that need to be told so that moms and families can know that healing is possible. This podcast is meant to offer information and awareness and is not a replacement for treatment by a professional. Thank you for being with us today. Hi, and welcome to Mom and Mind. I'm your host, Dr. Kat. Today, we are happy to have Dr. Karen Post from Maternal Mental Health Now on the episode with us. Karen Post received her doctorate in clinical psychology from New York University. She's a clinical psychologist who specializes in maternal mental health, couples therapy, depression and anxiety, perinatal mood disorders, early childhood development, and parent-child relationships, and since 2009 has been the executive director of Maternal Mental Health Now, formerly known as the Los Angeles County Perinatal Mental Health Task Force. She maintains a private practice in Los Angeles, California. Welcome, Dr. Post.
Thank you so much for having me, Dr. Kat.
No problem. We're happy to have you here. So if we can start with how you came to do this work and how you got involved in perinatal mental health, maternal mental health issues.
Sure, I'd love to talk about that. So I think for me, my interest in this area came about when I became probably pregnant with my first daughter about 27 years ago. I was working as a psychologist at the time. I felt kind of anxious in pregnancy, but didn't really take note of that. And then my postpartum adjustment was very rough. I was highly anxious and had trouble eating and couldn't sleep when my baby slept. But really, despite all my years of training, graduate school and internships, I had no idea what was going on with me. And I think more to the point, I didn't want to know what was going on with me. I really had internalized a lot of the shame and stigma. And it was kind of twofold. It was the classic, I'm a mom, I should just be happy. And number one. And then the shame of, well, I'm a mental health professional. I'm not supposed to be so broken down. And so all of those things kind of conspired within me. And it took me a full 8 months in the postpartum period to reach out for help. So that was that experience. And it was rough on my marriage and just rough going. Then, I came out of it. Cut to, I have a second daughter and did not have a postpartum depression or anxiety experience at that time. But I was working at the Early Childhood Center at Cedars-Sinai in Los Angeles and began to realize that a lot of the young children I was working with, that their parents, their moms in particular, who were generally their primary caregivers, were suffering from depression and anxiety. So we began to take a look at that in that program. Also, that window of opportunity when the child is developing, that the population was 0 to 3 years old. So I initially felt, well, if we take care of the mom, this will really help what's going on with the child. But then I got to learn and see it may take a while for depression and anxiety to really ease up and for a mom to feel the more considerable relief. And so we learned to work dyadically as well to help the mom and the baby together. So anyway, that led to, at the time, the director of that program came to know a woman named Kimberly Wong, who was suffering from a severe postpartum, life-threatening depression. And at that time, she had severe suicidality, could not put two thoughts together. And she was, although she found help initially and was hospitalized, once she got out, And even until someone recognized that she was suffering enough to give her the right referrals, she really found that there were well-intentioned but uninformed providers in LA County.
Right.
And she had all the resources in the world. So 2007, she formed the LA County Perinatal Mental Health Task Force. And at that time, we were all volunteer. And since that time, we've grown into a pretty powerful organization for change in this area in LA County, with the support of lots of foundations and so many volunteers, and really a brain trust, the Brain Trust for Perinatal Mood and Anxiety Disorders in LA, lots of partnerships and key stakeholders in LA.
I know a little bit about the work that you guys do just because I know you guys and have been to a lot of your trainings, and it seems like your reach is very far and wide. Can you tell us a little bit more about what the organization does and the work that you do and the advocacy efforts that you're engaged in?
Absolutely. So our approach, while we focus on at-risk vulnerable populations for women and their families who have the multiple stressors, including poverty and all that comes along with it. We also, that's our primary focus, but we also are working to change the system of care for all women in Los Angeles. And, and so we go about that really in three ways. We do public awareness and stigma reduction, and that is the Speak Up When You're Down campaign with brochures in 7 threshold LA languages, and grassroots events, public awareness events, bringing communities together. And along the lines of reducing stigma, we have a grassroots movement, the Share Your Story Speaker Salon. And that's very important too, because that is working in a very culturally relevant way, adapting a curriculum to help moms know their story, share their story with other moms, peer to peer. There's a whole curriculum for it. And again, that gets adapted for various cultural groups so that women can really relate to the way that stigma kind of manifests in each group, and there are certain things that are very salient and very relevant to particular cultures. And although we can't generalize, there are things that are important, and so that really helps break down stigma. So that's awareness and stigma reduction. And to that end, we public service announcements, et cetera, and join with other organizations nationwide to reduce stigma.
That's great. So good.
Yeah, it's so good. I think, with between the work we're doing and so many people like you, Kat, and so many organizations and individuals that are working to do the same thing, I think it's really helping. And so for that, we have also a speakers bureau library on our website. So that's accessible, and people can use those videos to spread awareness and really take the shame and stigma out of the issue. So that's that. And the second part of our approach has to do with training and what we call technical assistance. So the training has to do with training providers, training all sectors of providers, doctors, that includes pediatricians, obstetricians, primary care doctors, nurse practitioners, home visitors, training mental health professionals, training child welfare workers, and early childhood interventionists, early childhood professionals, the legal system. So we have a curriculum and we tailor it to every sector and work actually with organizations to tailor the curriculum specifically to them. And the trainings are in person. So many trainings at many kinds of agencies and programs, trained over 1,500 individual providers just this year in LA.
Oh, wow. Congratulations. That's amazing.
Oh, thank you so much. And It is amazing, and we're so heartened by it. It's hard to keep up with the demand, and what we find, though, what people want and what we have come to see as important is not just people coming to a training, but to have follow up, so that all of the learning really results in practice change. And that leads into this idea of what we call technical assistance or mentoring and coaching, which is also then part of our systems change, which kind of dovetails with our third program or aspect of our work, which is policy and advocacy. So to this end, we are trying to change the system of care in LA County so that all women have access to informed providers. And going back to Kimberly Wong's story, she felt that if she has all these resources and she can't get help, what about women who don't have these resources? So beginning with them, and a general idea we're really working with now is meeting women where they are in their medical homes, because women will go for their prenatal care by and by, and more importantly, they will go for their well child visits, and they often will do that even if they're depressed. So it may be hard for them to take a mental health referral for themselves, but they, courageously, even in when suffering from postpartum depression, will show up for their babies, and even though it may be hard to do that. And so if we can meet women where they are, screen them and have the providers be aware, not just a pen and paper screening, but we train about empathy and how to be responsive, and then we can recognize the women who are suffering. I think of myself when I was having a postpartum anxiety and depression with my first daughter. I went into the pediatrician. I was a mess, but it would have been a great moment to get me, even with all of my internalized shame and stigma, for a pediatrician to say, hey, looks like mama may be having a hard time too, And so we're hoping for that kind of screening to be universal. We're working to implement that in LA. We have different grants to support us doing that. That one's from the California Healthcare Foundation. And we call it the Integration Initiative. So it's integrating perinatal mental health into medical settings. And I know, it's incredible. And it started with a pilot 4 years ago at USC Eisner, and now it's really growing, and we hope to spread it countywide and statewide, and for it to be a model for the country.
Wow, I really hope that happens. I mean, it seems like, I don't know what all of the other counties in the U.S. are doing to address this. Certainly there are some local efforts in the local counties to L.A., but it seems like you guys have put so much work and so much energy and really careful looking at how your program works and how your training works. Seems like it would be great if this could be outsourced to other counties or duplicated so that so that other counties could either use your model or take what works for them. Is that something that is possible?
Yes, absolutely. And we would love to be able to help other counties. We currently do in a more informal way. They will call for just some advice or to ask how we've done things. But we would love to be able to do that more formally and to be able to spread the word that we can do that. And we'd really like to be able to. It's a really great idea.
And also, you have so many different cultural and ethnic groups in LA that it sounds like you may have, because you already have information in so many different languages and you're tailoring the speaker salon to be able to be used in different cultural groups, that might also be useful for other counties who maybe have some of a mix of culture the way LA County does?
Yes, absolutely. Yes.
So the work that you guys have done in terms of being able to support other counties, you said you already are doing that on an informal level. And how is that working? What does that look like?
It really, at this point, just looks like somebody calling us up or saying, do you have some time to talk? And us having some conference calls and folks kind of picking our brains and us sharing kind of informally what we've done. And yeah, but I think it would be nice to think about making that more structured and then more readily available so folks know it's available.
And it sounds like the work that you're doing is effective as well. You have had, I think you said 1,500 people trained already this year. Are you getting feedback from other providers in the community or consumers, people who are using the services?
Yes, great question. So a couple of things. We formally evaluate our programs. We have an external evaluator, so we're always looking at how we're doing. People fill out evaluations, and we ask those questions, and we measure. We have different metrics to look at. Was the training effective? What could be improved? What was gained? And then we have follow-up, 3 and 6 month follow-up data. How have their practices changed? Was it helpful? What would they need to further support practice change? Yeah, and then, I hadn't mentioned, but in terms of systems change, one of the big barriers that we found, and so Gabrielle Kaufman is the director of our training program, and Joe Bloomfield is the director of our policy and advocacy program. And Gabrielle develops with the Training Institute, all of the curriculum and tailors the trainings. And Joe has been working on other more global aspects of systems change. And to that end, together as a team, our whole Maternal Mental Health Now team really found that we were training, and also part of the training is learning how to screen, but that many providers systems-wide were reluctant to screen for many reasons. One of the barriers is what's going to happen. We're going to screen. We're going to see that a woman might be depressed or anxious or might need help, and we don't know where to send her. And so to that end, Joe spearheaded the development. We had already had a very basic, undeveloped resource directory. And with a grant from one of our foundations, private foundations here in LA, she grew the resource directory. And it's a first of its kind, I think, groundbreaking directory that's on our website now and can be embedded in other folks' websites, which is 240 vetted resources. It's so great. And we're, so that includes the whole spectrum. About 80% of the resources focus on low-income women who have no insurance, no pay or low pay. And then the rest are across the gamut for people who can privately pay as well. And that includes everything from, doulas to psychiatrists to psychologists, social workers, everybody. So in terms of outcome, we're seeing over 1,000 hits a month.
What? That's amazing. That's so good.
I know, and because of people like you,
I do refer people to that directory often.
Are you finding that it's helpful?
Oh, it really is. Even people who are from out of the area. I've had people in Northern California, on some of these listservs that I'm on say, hey, I need a referral for somebody in LA. And some of the other providers might know someone personally, but LA is so big. And it's hard to say, you give a resource to somebody who is in, I don't know, Santa Monica, but they really need to have a resource closer to Culver City or somewhere else that could be hard to get to. So giving them the resource directly so that they can search in their area has been very helpful, both within the county and people who are looking for resources that could be on the other side of the country.
That's so great to hear. And so the resources you can search by language, insurance, as you said, location, and it's really great. And also the kind of evidence-based practices they're doing. Are they doing couples work? Are they doing work with mom and baby? Are they doing family work? Are they doing IPT or cognitive behavioral therapy or supportive therapy? All sorts, peer, groups. It goes on and on. So it's very helpful.
Yeah, it's a fantastic resource. And I think because LA is so big and there's so many different pockets, as everybody says who lives around here, you have to drive 45 minutes to get anywhere. It's very helpful to have localized resources or where you can find localized help to wherever that mom is. It's otherwise you're just doing endless searches online for, you have to type in all the right information to find the exact right thing you need. And I think that that's been a barrier to a lot of people, just because resources might be there, but if nobody can find them, then how useful is it? So this speaks directly to that issue and makes it accessible to everybody really quickly.
That's so great to hear. That's the hope. And we're constantly beating the bushes. And because of the directory, now providers are coming to us that we didn't know about saying, hey, we provide those services. Please list us. So that's really been a way to increase the number of available resources that folks can know about.
That's so good. So hopefully if there are other counties listening or other people that are providers elsewhere, this could spark some ideas to make these services more accessible or more easily findable. Yeah. Is that a type of support that you would also be able to give people who are other providers who are calling in? How can we do this? How did you do this?
Absolutely. Why should people have to reinvent the wheel? It took a lot for us to learn how to do this. It's very successful. Yeah. And it, nationwide, it really does address one of the barriers to screening. We all want everybody to screen, but they're reluctant. So it's not the end all and be all. It's not the answer to everything, but it really does address a significant barrier. And so we'd be happy to train or teach or impart what are the, what was the recipe really for doing it?
Right. So if I can also ask, there are listeners in this audience who are, both providers and practitioners, but moms as well. In terms of the work that you're doing, or maybe, just some hope that you can give to the moms that are listening about getting help and finding resources, what kinds of things are you seeing that are useful with your program, or any type of words of hope that you can give to the moms who need help?
Such a good question. I really believe that for moms who are suffering with any of these sorts of conditions and feelings, if they're having a lot of anxiety, if they're having postpartum depression, or anything related to emotional wellness in pregnancy and the postpartum period, which can last up to a couple of years, we know sometimes or more, that I know that these conditions are very treatable. And the most important part, and that's where stigma reduction comes in, is to really reach out for help. And to do that first, we have to know it's okay. And it's very, very common. And there is no shame in it. And it's very important as women that we become empowered to get the help we need and to ask for help. And once you do, it's not like all the doors will just easily open, but the door is opened more than just a foot in the door, and then you will find help. And different things help different people. And there's no, I think it's important to remember that. So it's great to hear from other women, but to remember every woman's story is different. And some women may be helped simply by just talking to other women. And, it's important for all of us to really come from an empathic place. And so sometimes all we need is someone who can really, truly, deeply listen to us sometimes and understand, and that begins to ease things. Sometimes we may need medication. Sometimes, in addition, for me, at 8 months postpartum, psychotherapy was the thing for me, and that helped me to feel less and less brittle. I've worked with patients who someone gave them a heads up. Hey, you have some risk factors when they were in pregnancy. Various risk factors such as early childhood loss, early trauma, a history of anxiety and depression or bipolar disorder, trauma, early trauma, or many things. And so we don't always know that we have the risk factors, but if we can learn about them, then we can put preventive things in place. So I've worked with women who had so many risk factors, but they got to know that as somebody told them about it. They were open to hearing it. And then they reached out for help while they were pregnant and actually prevented were in some cases actually to prevent, postpartum adjustment wasn't necessarily easy, but they didn't fall down as low as they might have. And so different kinds of therapy are helpful: psychodynamic psychotherapy, cognitive behavioral therapy, various kinds of supportive therapy. So it's just a matter of working in a coaching way with you and your baby. Sometimes is very helpful to some women, sometimes not. Bringing in a partner to the therapy experience can be very helpful. So, learning about all the things to manage your mood. A lot of things can be helpful, but I think it all starts with reaching out for help.
Yes. So I think one of the ways that, I'd like to direct people back to your website, www.maternalmentalhealthnow.org. And there is a Find Help Now button that'll take you directly to the directory. So you don't have to be a provider to look for someone. Anybody can go on this website and look for a provider. And sometimes I think even consults for medication could be part of a search here. If someone's already working with a psychiatrist or a nurse practitioner and needs to find a specialist, a reproductive psychiatrist, that is a possibility.
Yes.
And then also, you guys have a lot of ways to be connected on Twitter at MM Health on Twitter, Facebook Maternal Mental Health Now, and on Instagram also Maternal Mental Health Now. So there's a lot of ways for people to stay updated and get messages of hope. As people are scrolling through looking at all the stressful things in the world, it's nice to see one or two messages of hope in there. And you guys do a really good job of that.
Well, you do an amazing job, Kat, of spreading the word. And this podcast is amazing to continue to spread all the awareness. You work so hard and effectively for that. So, yeah.
Thank you so much. I really appreciate that. I want to thank you so much for being on with us today and taking the time to talk about maternal mental health now and all the awesome work that you guys do. And I hope that this is another way for people to find your resources, reach out to you guys for consultation if people want to bring this work into their counties and to their communities. You guys have a really good model that I think would be great to have replicated elsewhere. So thank you so much.
Thank you, Kat.
By joining us today and listening, you're a part of the growing community of people who are aware and concerned for mothers and families during this beautiful and sometimes very difficult time of life. Please take a moment to subscribe, rate, and review this free podcast so that Mom and Mind can be found by moms, families, and providers who will benefit from hearing our talks. If you or someone you know is having a hard time, help is available. Please look for resources for help at momandmind.com, where you will also find links and information from today's episode. Thank you for listening and being a part of the Mom and Mind community.